Welcome back, dear viewers. And now cosmetic procedures have become more popular than ever, with countless treatments promising tighter, smoother, and younger looking skin. But are these procedures safe for everyone? And how do we know which treatments are truly beneficial? Today we're joined by Dr. Abdalaziz Almokhaizeem, consultant dermatologist specializing in medical dermatology, laser treatments, and cosmetic dermatology to discuss fibroblast skin tightening and chemical skin peels, separating facts from common misconceptions. Dr. Abdalaziz, welcome to Good Morning Kuwait.
Thank you very much for this introduction. Thank you.
Starting our interview, Dr. Abdalaziz, what is exactly fibroblast skin tightening, and it is really a non-surgical alternative to skin tightening procedures as many claim?
Yes, so the term fibroblast skin tightening is a broad term. Basically, our aim is to stimulate the fibroblast. So just to get that to have a concept, the fibroblast is the cell that produces collagen. And as we age, especially around 40 to 44, this is where the drop of the fibroblast become very, very visible, and the drop of the collagen. Therefore, science has been shown that they tried many studies and to try to stimulate the fibroblast to have something non-surgical that can help to give you similar to a surgery outcomes, and to try to get more collagen as we age. So that term fibroblast skin tightening have many devices underneath it. One of them is microneedling frequency. One of them is lasers, actually. Most of the lasers stimulate collagen, and that's been shown very clearly in the scientific literature as well. And also there's some sort of procedures like chemical peels that can also help with fibroblast stimulation to a lesser degree.
Doctor, from a medical perspective, how does this treatment work beneath the skin? And what happens to the collagen and the skin supporting structure after the procedure?
That's a very good question. So the main aim of that procedure is basically to have a controlled injury to the deeper layer of the skin. Why do we want to do that? Is to stimulate something called wound healing cycle. As any wound that you might get, or anyone might get, the end result is a scar.
Of course.
But if you get that scar deeper in the skin, that's actually pure collagen, and more firmness, more tightening of the skin, more eventually younger looking.
So the more scarring people say when they get the treatment, the more better result, let's say? And
more complications. So that's where the qualified practitioner comes into place. He sees the color of the skin, he sees the response to the skin to injury. If someone have a lot of scars from previous operation, they might get scar from that treatment. So you have to have a better control and better settings. You do it gently first and see how the outcome is, and then you go higher as you move on the treatment.
Exactly, doctor. Who is considered an ideal candidate for this treatment? Are they people who should avoid this kind of treatment?
Yeah, there's many people who should avoid that kind of treatment, especially people who have keloids. I don't know if you heard about the term keloids. Basically, someone who have excessive amount of scars for any minimal injury. So any tiny injury to the skin, they will get the biggest scar that is very resistant to treatment. So these people are out of the equation. However, who are the candidates? Now, anyone who want to take care of their skin. Okay, these are all elective procedures, but specifically the age from 40 and above, that drop in collagen become very visible. And I always advise, even patients that comes to me, try to have at least one procedure done just to help the skin to have more of that fibroblast stimulated to produce more collagen, because it will be degraded with time. So aging, people with laxity, a lot of laxity, people who are who want to take care of themselves, because these things has been shown to have a better skin quality, not just collagen, but also quality.
Doctor, there is a popular perspective. They say start your dermatology treatments earlier than the qualified age. Is that some kind of true?
There has been any scientific backup to that. I always say to the patient, there's always time that you can do that operations or procedures. However, if the outcome that the expectation of the patient is high, then that might be something true. Try earlier because as we age, our outcome basically is to try to stop aging. That's the main aim.
Doctor, many people undergo this procedure in beauty clinics. What are the risks if it's performed by someone who's not having the proper medical training?
Okay, so for our skin, the most common complication is actually pigmentation. And pigmentation, or sometimes excessive scarring. You might get scarring instead of, collagen. So it's really important to go to someone who's very qualified. And the main aim to choose someone who's qualified is that when they see the side effect, they intervene immediately. They know, I have to now start some sort of treatment, some sort of steroid, some sort of anything that can stop the inflammation to keep it under control. Because if it's went out of control, then you get more side effect like pigmentation, and especially if that's in a very visible place like the face, for example, the forehead. That's not very good looking for the patient.
Exactly. Doctor, you've mentioned scarring, pigmentation.
Yep.
What causes these complementation, and can they become permanent?
Yeah, becoming permanent, I don't think that they are permanent. There's always treatments that we can always tackle them. However, the duration is long, especially with pigmentation. The duration we're talking about like at least minimum 3 months. And that's a very long time, 3 months, sometimes up to a year. So it's really important to deal with the side effect. If you see some markers during the treatment or after the treatment, and you didn't do anything, you just give the patient some moisturizer and tell them go home, then yeah, it might be, I wouldn't say permanent, but at least it would last some years until it goes away completely.
Doctor, there is a treatment and there is post-treatment. And sometimes post-treatment is as much important as the treatment itself. How post-treatment care can affect the patient himself or herself? Yeah,
I would say 50% from the doctor, 50% from the patient. You have to take care, you have to apply whatever the doctor advises you, whether it's moisturizer, whether it's topical steroid, because topical steroids also, sometimes we use that a lot in the clinic. We use that just to control the inflammation. We don't want it to go too far, because if you get it too far, especially in our type of skin, the pigmentation is more than the Western type of skin, where they are lighter, they don't have melanin. We are rich of melanin. And that's something, it's a bless, because we don't get cancers, they get cancer, so it's a trade. But we get more pigment. So that's really important to apply whatever the doctor tells you after the treatment.
Definitely. Doctor, let's speak more about chemical peels. I think every woman here in Kuwait, she tried chemical peeling. What is chemical peeling and how it can be done effectively?
Okay, so chemical peels are, it's a group of basically products that exfoliate the skin, right? They remove a little bit layer of the skin, and it depends. There is like superficial chemical peel, there is medium, and there is deep. Depending on the layer of the aim of our treatment. We want to go deeper or we want to go more lighter to the skin. For our skin, Kuwaiti skin or whatever, like in the Middle East, you don't go beyond superficial, because the side effects outweigh the benefits. It's way higher. You get more pigment, you get more scarring as well. But in outer Western countries, they go a little bit more, because they get, they try to prevent cancers and other stuff. But for our more cosmetic aim is we just go superficial peels.
Yes. Is chemical peeling appropriate for everyone, or for skin type or proper skin type, let's say?
Yeah, I would say it's a safe treatment. Unless the patient is pregnant, yeah, it's a very safe treatment. However, it's also very high in complications, because you have to be very time efficient. You have to apply the treatment, and you have to stand next to the patient, seeing the side effects, seeing the end results, I would say. If the patient gets more of that redness or more of the frosting or the whitening of the skin, then you have to terminate the treatment. Otherwise, you get more complications. But generally, it's a safe treatment, very effective treatment, nice. It helps in making the skin more fresh, I would say.
Can it be done in summer, doctor?
Well, yeah, I mean, ideally it's in the winter, but I mean, in Kuwait, where like most of the weather is summer, so you have to like make a deal and try to basically do it in a shorter period, but many sessions. I would say that would be ideal. Instead of having a full session, and the patient go outside, exposed to the sun, where it might damage the skin more. Try to do it in a shorter period, and more sessions, then you get the better results.
Doctor, some people choose chemical peeling as a yearly procedure. Is that kind of a nice routine, let's say, to keep the skin fresh, tight, and let's say get rid of pores and pigmentation?
Yeah. You can't keep it. I wouldn't say more than once a year. Once a year, I would say is something that I would advise with other stuff.
Of course, not alone. Doctor, the post-peeling, there are of course common mistakes, and I'll tell you one from my own experience as a patient, which is peeling the skin rather by my hand. So what are the common mistakes people do after chemical peeling?
Yeah, well, I mean this sounds very rough. I mean, people.
Not satisfying.
but I mean, the common mistakes is that the skin after the procedure is very sensitive, like very sensitive, and applying an unknown product sometimes can lead to more harm, especially retinols. And retinols nowadays is like in all the products, especially the commercial products, and this might irritate the skin more, and you get something called retinol dermatitis, which is like you have to treat it separately now. Yeah. It's like a complication in a side effect, so it's not the best situation to be in. So ideally just moisturize, stay out of the sun, and that's it.
Amazing. Doctor, let's talk more about tanning. Some people do tanning and they want chemical peeling. Can both be like aligned? Yeah,
so I have to say something. I'm like against tanning in general. I don't think any dermatologist would agree in tanning. Tanning is like the worst thing that you can do to the skin, because basically it ages the skin, it destroys collagen immediately, and you get like oxidation of the skin. Like it makes your skin like more oxidized and more inflammatory state. Okay, that's number one. With chemical peel, that's a contraindication. You don't do chemical, you don't do any procedure like lasers, microneedling, any procedure with tanning.
But can the people get rid of tan by chemical peeling?
That would be a big bargain. I mean, yes, you can, but the side effects is way high. Like you might get more pigmentation, more scarring, but yeah, you might get it. You might get like you might remove the skin. That makes sense. But I mean, I would say that the chance of you getting uneven pigment would be higher.
Of course. Doctor, let's speak more about social media. Of course, social media now is full of at-home acids and DIY peeling products. When can home peels be safe, and when do they become dangerous?
Yeah, okay, so if you do something like from TikTok or Instagram, someone who's like making it up from zero, from the scratch, then just don't do it, because we don't know the ingredient of that of these products. Okay, but if you buy it from like a certified company, a company that's known in the market and known in the industry of cosmetic, yeah, then that would be considered safe. But again, it's not that effective.
Exactly.
So you'll be paying money, but the expectation should be very less.
Yes. So it's better to be done in the clinic.
Yeah, to get the result.
Exactly. Yeah. Better result. Of course, you have to choose the right dermatologist, because if we did it by ourselves, it won't be as much as effective.
Yeah.
As we think.
Yeah. Yes. Exactly.
Doctor, finally, for someone considering either fibroblast skin tightening or a chemical peel, what are the most important things they should know beforehand? How can they choose also qualified physician and the safe clinic?
Yeah, well, that's I would say that always the best investment to do is the investment in yourselves. And because that's an important investment, you know, you have to choose the dermatologist or the qualified practitioner carefully. Read their CVs, see their work, you know, because again, it's your body, it's your money. You don't want to lose that in someone who, and you get more complications. And that's very common, you know, that's very common, and especially in untrained hand. So always, before doing that investment, choose carefully, read carefully, see basically the CV of the dermatologists that are going to do the procedure.
Yes,
and there's many good dermatologists in Kuwait. We're kind of lucky.
Definitely, Dr. Abdalaziz. Our skin, of course, is our most expensive investment, especially living here in a hot climate. We need to take really good care of it. Thank you for joining us here in Good Morning Kuwait.
Thank you very much.
So, dear viewers, social media has made it easier than ever to share news, photos, and videos with just a single click. But have you ever stopped to think that one simple click could have legal consequences? As our digital lives continue to grow, it's becoming more important to understand where the legal boundaries lie online. In this report, we explore some of the most common cyber crimes and learn how we can use social media safely and responsibly.